Workplace mental health has become a significant issue and challenge for businesses throughout the COVID-19 pandemic. Employee assistance programs and general support services like Lifeline are seeing significant increases in requests for help. Pair this with the most recent statistics indicating that the average mental health related workers' compensation claim lasting more than 20 weeks. It's certainly something that businesses need to stand up and take notice. To help shine a light on this, On Demand HR reached out to Matthew Council from Alutius Group, a national EAP provider, to get their insights as to what's really going on at ground level. And we wanted to share this conversation with our broader audience.
Welcome, Matthew. Thank you for coming on today to talk about some of the challenges that we've got in the mental health space, obviously with the government restrictions as they are at the moment, and with people obviously being largely within their homes and only with limited things that they can do in these present times. I was really interested in getting an insight into some of the mental health considerations. It has been something that perhaps there probably hasn't been enough talk about, I feel, with clients being focused on the day-to-days of simply being able to operate their businesses and work through the situations just to trade and just to provide for their customers as best they can. So, look, I had a few sort of questions to go through, and I guess probably the first thing I would really like some insight on is for you to give me an understanding of what are you finding the common mental health challenges are at the moment. What is it that people are struggling with the most based on your understanding and through the use of Altius's EAP program and People Sense? So what insights have you got for us, Matt, in that regard?
Yeah, thanks, Clint. As you mentioned, we're a national EAP provider, and so we've had a look at a lot of the data and statistics that are coming out of that. And it was obviously during the last 12 months that we started listing COVID-19 and other related causes for why people are presenting to us. So we actually have started to be tracking that data. And it's interesting that there is a significant spike and continuing increase, particularly in this year, in COVID-related stress, anxiety matters. And we can dive into some of those, which is returning to the workplace and around vaccinations and things like that. But also, just more broadly, there's been at least a 20% increase in the demand for our services. Yeah, which is significant. On scale, that's a lot of numbers. When we compare that, obviously, with the data coming through the likes of Lifeline, from the numbers that they were looking at, inquiries that they were fielding in 2019, there's been a 30% jump in inquiries. So the writing's sadly on the wall, and all of this, whether it's particularly related to COVID or it's just a matter of the glass getting too full for people, that we can only bear so much, it is continuing to cause mental health strain and concern, and those usage numbers and the numbers of people reaching out to different services is certainly going up.